Dysport is a botulinum neurotoxin type A from Ipsen. It is an acetylcholine release inhibitor that acts like a neuromuscular blocking agent. Here are the major points covered in Dysport reconstitution. Around the globe, Dysport licensed therapeutic indications in adults include arm symptoms associated with focal spasticity in conjunction with physiotherapy, spasticity of the lower limb in patients following a stroke, spasmodic torticollis, blepharospasm, hemifacial spasm. Dysport is also licensed in children to treat dynamic equinus foot deformity due to spasticity in ambulant pediatric cerebral palsy patients, 2 years of age or older, only in hospital specialist centers with appropriately trained personnel. Dysport is a white lyophilized powder for reconstitution. It is supplied as a single-use sterile 500-unit vial or 300-unit vial. Dysport contains the active ingredient Clostridium botulinum type A toxin hemagglutinin complex. Dysport is reconstituted by using aseptic techniques. The following elements are needed: a medical equipment tray, 1 pair of gloves, sterile preservative-free 0.9% sodium chloride solution for injection, alcohol wipes, 1 2.5 milliliter syringe, 1 1 milliliter syringe, 1 21 gauge needle, 1 23-25 gauge needle or an electrostimulation needle, 1 puncture-proof sharps container. Unopened vials must be maintained at temperatures between 2 degrees Celsius and 8 degrees Celsius. Take out the box from the fridge, and before using Dysport, please ensure package integrity. Dysport should not be used after the expiration date printed on the vial. Reconstitution instructions are specific for each of the 300-unit vial and the 500-unit vial. These volumes yield concentrations specific for the use of each indication. Let's first have a look at the reconstitution process of the 300-unit vial. Dysport may be reconstituted with either 0.6 milliliters to yield a solution of 500 units per milliliter, representing 50 units per 0.1 milliliter, or with 1.5 milliliter to yield a solution of 200 units per milliliter, representing 20 units per 0.1 milliliter. The 500 units may be reconstituted with either 1 milliliter to yield a solution of 500 units per milliliter, representing 50 units per 0.1 milliliter, or with 2.5 milliliter to yield a solution of 200 units per milliliter, representing 20 units per 0.1 milliliter. As an example, we will demonstrate reconstitution of the Dysport 500-unit vial with 1 milliliter of saline diluent. In this case, after reconstitution, the dose in the Dysport vial is 500 units per milliliter. Dysport should be reconstituted in a suitable room by an experienced injector for minimizing the risk of incident when handling. Put on gloves. The saline diluent used for reconstitution is a sterile, preservative-free 0.9% sodium chloride solution. Open the 0.9% saline solution vial. A 21 gauges sterile needle could be used and a 2.5 cc syringe. Draw up 1 milliliter of sterile preservative-free 0.9% saline solution. Expel any air bubbles in the syringe barrel if needed. Prior to use the Dysport vial, simply flip the plastic cap off and clean the stopper with an alcohol wipe. The alcohol should be left to evaporate before piercing the rubber stopper. Insert the needle into the Dysport vial and inject the saline diluent into the vial very gradually. Do not force the saline into the vial. Gently rotate the vial with the syringe still attached. Do not shake until the white substance is fully dissolved. Avoid any air bubbles that could lead to protein denaturation. Reconstituted Dysport should be a clear, colorless solution, free of particulate matter. Slowly draw the reconstituted Dysport solution from the bottom corner of the vial. Do not invert the vial. Remove the 21G needle and attach the 23 gauges or 25 gauges sterile needle or the electrostimulation needle. At this point, the syringe contains reconstituted Dysport at a concentration of 500 units per milliliter. Properly prepared, it is now ready for injection. Dysport is administered into the affected muscles by intramuscular injection in adult spasticity, cerebral palsy and cervical dystonia, and by subcutaneous injection in blepharospasm and hemifacial spasm. Immediately after treatment of the patient, any residual Dysport which may be present in either the vial or the syringe should be inactivated with dilute hypochlorite solution, 1% available chlorine. Discard needles and other chemically contaminated materials in accordance with local regulations. Data illustrates that Dysport has chemical and physical stabilities 24 hours after reconstitution when stored between 2 and 8 degrees Celsius protected from light. But it is recommended to be used immediately. Dysport should not be frozen. Dosage and administration. The potency units of Dysport are not interchangeable with other preparations of botulinum toxin products.